Hey there, everyone. Welcome back to Bio 120. We are going to cover Chapter 11, which is Cardiovascular System, today. And so, why don't we switch over to our lecture notes and take a look at those? I have the book up as well, and we'll use that as we need to. So, the first. And one thing that you probably are noting is sometimes we're talking about things in lab a little bit before lecture or vice versa, and we can't have them line up exactly. So there's going to be a couple things here that probably you've been working on in lab, and you'll be like, oh, okay, yeah, I remember this, and it'll kind of reinforce concepts that we did in lab. So we know that the heart's function, right, what the function of the heart is really just to pump blood. It doesn't do much else. And there's a couple other little things that it can do, but for the most part, its job is to pump blood. The vessels that go in and out, they provide conduits for the pumped blood to travel throughout the body. Okay, so we're going to be pushing blood through the body using our heart, and we're going to talk about that for a good portion of today's lecture. So, where is the heart? Well, it's between the second and the fifth ribs, and you can see there, slightly left of midline, meaning that the bulk of the heart is on the left side. There's less heart on the right side. It's within a pericardial sac. So the pericardial sac goes around the heart like that. And also, we'll just note that right here is where the apex of the heart is, and that's the point of maximal intensity. And that's right at that fifth and sixth rib. 1, 2, 3, 4. Between fourth and fifth, fourth and fifth rib. And often stethoscope is put there first, so that your nurse practitioner, physician, he or she can really get a good, strong heartbeat sound. And so that's what they're going to go to first, and then they'll move around as needed. So it is slightly left of midline. It's within a pericardial sac. Now, we can kind of see part of that pericardial sac here. Oh, by the way, this is page 358. Both of these are both diagrams. Oh no, that's not true. This one is page 358, and this diagram here is page 359 in your book. But they look exactly like this, so we're just going to use this one. So what you're looking at now is you're seeing that pericardial sac. That thin little line that goes all the way around here is the pericardial sac. All right. And here it is right here. There's a fibrous portion and then an intermembranous portion. Now you might remember we talked about serous membranes that were lining cavities and covering organs. And so we're going to get back to that again here. So there are 3 layers of tissue in the heart, and then there's the outer layer around the sac. So the 3 layers are the epicardium, the myocardium, and the endocardium. Epi is topmost layer. It's right here. This is the same thing as the visceral pericardium. And remember, visceral means organ, pericardium means heart. So this is the layer of the serous membrane that covers the outside of the heart. Now, deep to that is the myocardium, and this is the heart muscle itself. Okay, and this is what contracts and causes blood to be ejected from the heart. On the innermost part, the part that's lining the chambers, is endocardium. And this is continuous with the same lining that's in blood vessels, which is called endothelium. And so the blood is going to touch this layer. Okay, so these are the 3 different tissue layers. Okay. And then, just for completeness, that epicardium folds over, and then it gets a new name. This is our parietal layer of the pericardium, the parietal pericardium. And that's one of our serous membranes. And then this is the fibrous layer of the sac, the pericardial sac. There's fluid in between here, inside that little area. That's where the serous fluid is, so making sure friction is very low. Every time the heart beats, it'll rub against the sac that it's in and rub against organs nearby, and we don't want it to damage them. So we have serous fluid or pericardial fluid there. Okay, now our circulatory routes. Pretty straightforward. This picture is listed on page 361. And all we're saying here in this thing is we can see two of the three circulatory routes. We can see the pulmonary circuit and we can see the systemic circuit. We can't really see the coronary circuit because it's inside the heart itself, but we'll talk about that in a minute. So the pulmonary circuit is where deoxygenated blood goes into the lungs, becomes oxygenated, and then comes back to the heart to be pumped out. So oxygen is getting picked up here, and CO2 is being dropped off at the lungs and exhaled, and we bring that oxygenated blood back to the heart. That's the pulmonary circuit. Okay, pulmonary circuit, picking up oxygen, dropping off carbon dioxide. Then we have the systemic circuit. This is from the heart to the body and back to the heart, where we're dropping off oxygen at our tissues of our body. We're picking up waste products and things like carbon dioxide as well, and we are bringing that back to the heart so that deoxygenated blood can be pumped to the lungs and be oxygenated. So these two circuits work hand in hand. They work together. The systemic circuit is going to then feed into the pulmonary circuit. The pulmonary circuit's going to feed back into the systemic circuit. Now we have one more route of blood that blood takes, and this is in the heart itself. This is where we actually send oxygenated blood to the heart, and we give all the heart muscle oxygen and nutrients and ATP and things like that. And then we also pick up waste products here, like carbon dioxide and other waste products, and then we want to get it out of the heart, and so we can get rid of those waste products. So our coronary arteries are the ones that supply the heart, and our coronary veins give the deoxygenated blood back into the heart chamber itself. Okay? Now, you can follow a drop of blood by following the pathways here. And so the first thing is we want to remember that there's four chambers. There's a right atria, there's a right ventricle. And ventricles are down below, atria up above. And you can see those two atria right here, 1 and 2, and two ventricles here, 1 and 2. And so we have a right and left of each of these. Okay, and then we have four valves. We have the right AV valve. Let's see if I can get this. Hold on one sec. Let's see if I can do it there. Right, there we go. Right AV valve. Now, AV stands for atrial ventricular. And so what this means is this is the valve that's in between one of the atria and one of the ventricles. Okay, so this is our right AV valve. Then we have our right semilunar valve. Same thing, I'm having trouble here. Let's see, there we go. Semilunar valve. This one has another name, which is called the pulmonary semilunar valve, and we'll write that in, pulmonary. And then over on this side, we have our left AV valve, and between the atria and the ventricles, and then leaving the ventricles, we have a left semilunar valve, and this is also called the aortic valve. And the aortic and pulmonary, they tell you where the blood is leaving. So right here is the right semilunar valve, and that semilunar valve is going out the pulmonary trunk and going to the pulmonary circuit. So we call it the pulmonary semilunar valve. And there's a small valve right here, it's a little hard to see, is the left semilunar valve, and it's going to the aorta. This is the aorta here. So we call it the aortic semilunar valve. Okay, now you can trace a drop of blood going through all the different parts of the heart. And if you look at page 360 of your notes, which I'll bring up right now, you could, and here now just quickly, we can see some of the things we just talked about. Here is our right and left atria. Here is our right and left ventricle. Here is our right AV valve, also called tricuspid because there are three little flaps or cusps We have our left AV valve, which is called bicuspid because there's only two of them. Okay. That also has a third name called the mitral valve. So many names. This is our left AV valve. Our right semilunar valve, which is also usually called the pulmonary semilunar valve because it's going out the pulmonary trunk to the pulmonary system. And then right here hiding is our left semilunar valve, which is usually called the aortic semilunar valve because it's going to go to the aorta. It's going underneath there and going to the aorta. Okay, so we can trace a drop of blood. If you look at the picture here in our notes, hold on. What this little arrow is showing you is that we start with deoxygenated blood coming back to the heart, and then we, let me zoom in here so I can make a prettier arrow. And then we send that deoxygenated blood to the lungs, and then we send it back through the heart and out to the body. And so if you follow these arrows down, over, and up again, you'll get the route. And it is good to know and kind of understand that route. Why don't we go through the route on the next page, and you can follow along with your notes if you want, or just listen in. So first off, deoxygenated blood comes from the superior vena cava. That's all of the structures up at the top part of our body. And then the inferior vena cava from the lower portions. We also get deoxygenated blood here from our heart itself that will come in via the coronary sulcus. And those three areas will dump blood here, and they'll go through the right AV valve, so they're in the right atria, and go and get dropped down into the right AV valve and go into the right ventricle. Then that blood, when the ventricles contract, will pump the blood through the semilunar valve, the pulmonary one, and it will go both to the left and to the right lungs, through the pulmonary trunk and here, and pulmonary arteries there, and our lungs will get the deoxygenated blood. Carbon dioxide will leave. We will pick up oxygen. We will then send the oxygen back via our left pulmonary veins and our right pulmonary veins, and there are four of them, and they all go in here to our left atrium. Once in the left atrium, blood will drop down through the left AV valve. It will go into the left ventricle. Blood will then, when the ventricle contracts, be ejected through the aortic semilunar valve, go through the aorta, and go out to the body. Also right here at the aorta is where the coronary arteries are, so oxygenated blood will leave the aorta and go into the coronary arteries to give the heart some blood too, so it can do its job. So that is what we just went through. We just went through all of those terms. We went over here and went all of those terms. So it's good to kind of know the basic pathway of the blood. It'll help you understand when we're talking about things, what's going on. All right, so we want to talk for a minute about the heartbeat sounds, okay? And this picture is on page 362, and it talks about how the sounds are made and how when we listen for these heartbeat sounds, what we're listening for. So we usually call them a lub-dub sound. Sometimes this is also, we'll use P sounds, lub-dub, lub-dub. So the first sound here is the blood is being pushed back against the AV valve. So when the ventricles are contracting, we don't want to force blood back into the atria where they came from originally. We want blood to go out the semilunar valves. So the valves here, the AV valves that are open when blood goes in, they close up and lock and don't let blood going backwards when contraction occurs. And I'm going to switch over to me for a second here. And so these valves are kind of like this. And so they're open and blood can go straight down. And blood passes through them. But when we're contracting the muscle of the ventricles, what will happen is that pressure will increase and it will cause them to lock like this, okay? And they'll lock in place and no blood can go up, all right? Blood can always go in, through, and down, but the moment we contract the ventricles, they'll lock. There's little the tendinous cords that we looked at in lab. Those will hold, they're attached to papillary muscles, and they'll make sure that these flaps don't go like this and flap the wrong direction. So they help keep those closed. Okay, we'll flip that. go. So when those close, they make a little slapping sound. You can hear my hands come together, and that's our first sound. Okay? So the first sound is when blood is pushed back against the AV valves when the ventricles contract. Okay? Now, and that's this guy right here, right? This part right here. The second sound is the dub sound, and this is when the blood is being pulled back against the semilunar valves when the ventricles relax and expand. So what happens is we eject blood through the semilunar valves, and they go in the pulmonary trunk and in the aorta here. You can see that down here. They go through, and the semilunar valves are called that because they look little like half moons, don't they? They look like a little moon that's only in half. And so blood rushes through, but gravity will want to have blood go back into the heart. So blood will want to come back into the heart, and when it does, it goes down like this, and it will do the opposite. So if you come back here, your semilunar valves are more this way, and when blood is forced through them, they open, and so blood goes up like that. So they open, blood rushes out. But then, if blood is wanting to come back in, it will cause them to close and lock. Okay, and that noise that you hear is the second heartbeat sound. And so that's what we're seeing here. We're seeing the semilunar valves close, and we get our second heartbeat sound. Okay, great. Now, blood vessels. So there are different types of blood vessels in our cardiovascular system. And we'll go over just the basic three. These can be subdivided into different things. But we'll just go through these three to start here. So we have arteries, we have veins, and we have capillaries. All right, so arteries carry blood away from the heart. They always are carrying blood away. It doesn't matter whether the blood inside is oxygenated or not oxygenated. Arteries carry blood away from the heart. Now, there's a picture of an artery right here, and you can see and compare it to a vein. And this picture is located, let me find it here, what do I say? Page 371, yeah, there it is, page 371. Let's put page 371 in. And we can compare them, and so let's look at these different layers. So we're looking at kind of cross-sections of vessels, right? They've cut them apart so we can see inside. So the first thing we want to see is that the middle layer here has a lot of muscle. Do you see that? And that's smooth muscle that's all in this middle layer. This middle layer is called the tunica media, right? And it's very thick there. Notice how much thinner it is on this side. Compare these two sides, how thin it is right there. There's also a lot of elastic fibers because arteries will stretch. Whenever we pump blood out and into them, out of the heart, they stretch. And so they need to stretch and then contract back. So that's one clue that we're in an artery. Many thick middle coat, many elastic fibers, and I'll even write over here, lots of smooth muscle. Okay? Now veins are a little different. Veins carry blood towards the heart, like the superior and inferior vena cava are really big veins. They have a thin middle coat, just like we described. The other thing they have is they have valves. Now notice inside the endothelial lining, or what we call the intima layer, the innermost layer, there are these little flaps. They look very similar to the semilunar valves we just looked at, and really they, in effect, are kind of almost exactly the same. And what they will do is they will stop the blood from going backwards. So if blood is going in the direction of these arrows, if gravity wanted to push the blood down that way, these flaps would lock into place and not allow blood to go down. So when we're returning blood to our heart, the blood kind of goes above one and then kind of locks in place, and then goes above one and kind of locks in place, and it kind of ratchets its way up to the heart using these valves to prevent backflow. Okay? So that's an important thing to learn about veins. Veins have a much bigger lumen, and lumen is the opening that you see here. See this wide opening, the much bigger opening than arteries generally do. Pressures are higher in arteries, they have smaller lumens. Pressure is very low in the veins, they have bigger lumens. Now the third vessel that we want to talk about are capillaries. And capillaries are where we have gas exchange and nutrient exchange as well. So we have oxygen in and carbon dioxide out, right? But we also have nutrient exchange, nutrient and waste exchange occurring here. So anything that the body tissues need, they will get the nutrients through the capillaries. Anything they need to get rid of, like waste, they will release them from the tissues into the capillaries. Capillaries are much smaller. They only have the innermost intima layer, and so they only have the inner layer, and they're generally about one cell membrane thick. So they can have really good diffusion, all right, and that allows fast diffusion of nutrients and waste products in and out, okay? So those are the three basic ones. Now, small arteries, just to be complete here, are called arterioles, and small veins are called venules, okay? And then they become capillaries in between. So oxygenated blood goes through an artery system into arterioles, into capillary beds to give nutrients to tissues. Then waste products and carbon dioxide will come out venules. They will feed into lumen, the lumen of veins, and then veins will send the deoxygenated blood to the heart. All right. So that's the level of detail I want you to know right now. Okay. Next, we have how do we get, I was talking about the veins having to return blood to the heart. And so one of the things that we just mentioned was valves, right? Valves inside prevent backflow. And you can see one valve open and one valve closed in that picture. Now, there are other things, though, that assist helping fluid move. And we need this because arteries have really high blood pressure. They're near the heart. They originate from the heart, right? They're going away from the heart. And they're pumping blood at a very high pressure. But veins are on the backside of our capillary system. Blood is moving very slowly there. So they need the valves to help backflow. But then we also use our skeletal muscles to squeeze blood from one valve point to the next. So imagine if every time you move, your muscles squeeze a little and push some blood up to here above this valve. And then when we relax and blood wants to go back down, those valves close and the blood is now in this little area. And so the skeletal muscles help with this process. Okay? The other thing is that breathing also helps move the blood along. And this is because of our diaphragm. Our diaphragm pushes down on our abdominal organs. So every time you breathe, your diaphragm contracts and pushes downward. And it pushes down on your abdominal organs. And when those organs get pushed on, they squeeze blood out of the organs, and the blood moves along the venous system. So those are important. These three are important things to know about how veins need extra help. And so they have these three ways of getting blood moving from the low pressure area in the veins back to the heart. Okay, now we're going to talk about capillaries for a moment. Now the process of fluid moving out of the capillaries and in that fluid having a bunch of nutrients and oxygen, and the process of fluid moving back in is actually quite complicated, and we use a lot of different pressures and terminology to look at this. But we're not going to go into that detail in this class. So we really just want to hit a couple highlights here. And this is on page 388. I was just looking for the page number. And really what I want you to think about here is that blood plasma leaks out of thin-walled capillaries, especially on the arterial end of the capillary. Okay, so on the arterial end of the capillary, we have fluid that leaves, all right? Fluid goes out there. And the things that go out then are things like oxygen, nutrients, and then, of course, water. If fluid leaves, water is going out. All right? And that will allow oxygen to go to the tissue cells, nutrients to go to the tissue cells, and water to go into the tissue cells as needed. It always goes into the interstitial fluid first, and then it diffuses from the capillaries to the interstitial fluid and then into the cells themselves. Now, we tend to have a net movement of water going out on the venule side, right, on the venous side. And what is leaving? Well, any excess water, we need to take water out, and with it dissolve things like carbon dioxide and wastes. Anything that our body doesn't want is going to flow out on this side. Okay? So, blood plasma leaks out of thin-walled capillaries to provide tissue cells with oxygen and nutrients. Blood pressure will go down because we're losing fluid. When we lose fluid, then the pressure of a system drops. Okay? And then the fluid returns to the capillaries, bringing carbon dioxide and waste products from the tissue cells to be processed by our body. That's really all I need you to know right now about how these systems work. I do want for a few minutes to talk about some physiology of circulation and some vital signs and some other things. In lab, we tend to do some of these, and we want to look at some of these things. So the first, the three main vital signs that we think of as arterial pulse, blood pressure, and respiratory rate and temperature. Okay, I guess that's four really. But the arterial pulse is also sometimes known as heart rate because we can estimate heart rate by taking our arterial pulse. So if you remember back in the very first lab, I think you did a little exercise for me and you took your pulse, your radial pulse, the one in your arm, and we called it heart rate. And because we were saying that approximately every time you feel a pulse, is one heartbeat, right? And how do we know this? Well, it's a pressure wave that you're feeling when you feel a pulse, and it's caused by the relaxation and contraction of the left ventricle, pushing blood into the arteries, into the arterial system. Now, normally at rest, it's somewhere about 70 to 80 beats per minute, but some people have very low resting heart rates of like 60 or even below that, and some people have higher resting heart rates. But that's a good average to think about. Now, the second vital sign that we're interested in is blood pressure, and this is the pressure of blood against the inner walls of the blood vessels. So as blood moves through the blood vessels, it pushes on them, and it pushes them outward, right? And it causes pressure. Think of like a hose in your backyard. If the hose doesn't have any water in it, you often can take your fingers and kind of push the hose and kind of smush the hose together a little. But the moment that water starts filling the hose, it pushes on the walls, and now there's pressure there, and it's much harder for you to close off that hose. Exact same thing with blood pressure. This is the force that keeps blood circulating, our blood pressure. And it's very high in the arteries, as we were saying earlier, because the arteries are taking blood away from the heart, where the pressure is generated. And it's less or almost non-existent in veins at very low pressure. So when we measure pressure, what we're doing is we're looking at, and this picture is really nice and does a good example of it, and this is on page 383 in your book, but I'm just going to use this one because this looks great here, is what we're doing is we're going to measure, not at our heart, even though that would be the best place to measure, is we're going to measure right here in our brachial artery. As we put a blood pressure cuff over it, and we start to inflate the cuff with air. And when we do that, at some point, the pressure of the blood trying to move through and the pressure being pushed on the walls are going to equalize, and the blood is going to be stopped from moving into your hand. And so we record that value as the highest pressure. And this is the pressure during systole, right? Systolic part of the blood or the heart rate. heartbeat, and this is during contraction. And so we're watching the brachial artery get closed off at that high rate. We know that's our high blood pressure, our systolic blood pressure, the top number of 120/80. Then we let the cuff relax and we let air leave slowly, and we listen. And we often, in the stethoscope, and we often listen, and we can hear all of a sudden the blood will start to rush back through, and we'll hear the pulse again. And wherever that is happening, okay, when the sounds are rushing through, that's below 120, and that sound goes all the way to 70. And when we get to 70, we don't hear any sounds anymore. And when we don't hear any sounds, we know that blood is flowing fully and through the cuff, and there's no pressure on the walls anymore. And so that could be 70 or 80 millimeters of mercury, and that is where the heart is in complete relaxation, all right? And the vessels are in complete relaxation. So when we look at a value of blood pressure, we might say, oh, this person is 125/75. So we say, oh, the 125 is the systolic. That's their high pressure during contraction. And 75 is their relaxing pressure during heart relaxation. Okay. Nowadays, if you get up to even above 130, 135, over say like 85, we're saying that you're slightly hypertensive, and we'll talk about what that means in a minute here when we get to our disease states. Okay. Now, there are other factors that impact. Oh, by the way, we don't talk about the respiratory rate and temperature as our vital signs now because we're doing cardiophysiology here. But of course, respiratory rate's the number of breaths per minute, and temperature is looking at what your body temperature is. And we'll come back to respiratory later in a future lecture. Okay, so what are some factors that affect blood pressure? And I'd like you to know these examples and kind of basically how they work, but you don't have to go into a lot of details. But one of the most important ones is peripheral resistance. And what this is when the vessels constrict. All right, so body vessels constrict. And when they constrict, that means that the blood is pushing on the walls more and more frequently and not flowing through as smoothly, and so pressure goes up. And so this builds pressure overall. Our sympathetic nervous system can actually quickly constrict vessels and raise blood pressure. Remember, sympathetic is our fight or flight one. So if we need to get a high blood pressure for some reason, to fight off something, run away from something, our sympathetic nervous system can help. The second thing is cardiac output. And this is the volume of blood that's pumped out of the heart per minute. Okay? And we can increase the amount of blood being pumped out of the heart by increasing heart rate. And again, the sympathetic nervous system can do this. It can increase heart rate, the number of beats per minute, or this thing called stroke volume, the amount of blood pumped out of the heart per beat. So every time your heart contracts, a certain amount of blood leaves. If we can increase the amount of blood that leaves, we can increase cardiac output. And all of these things will raise blood pressure. If we use our parasympathetic system, we can quiet these things. We can slow our heart. We can make our heart work less hard and therefore have lower blood pressure. So like at night when we're sleeping, we don't need to have as many heartbeats per minute. We don't need to have as much stroke volume amount of blood coming out per beat, and therefore our parasympathetic system is letting us have a quieted heart. The third big one is blood volume. The more blood in our cardiovascular system, the higher volume, the greater the pressure, right? That makes sense. Here, let's do it in a different color. We did all these in different colors. Let's pick a different color here. The greater the volume in the cardiovascular system, the greater the pressure. Blood volume in normal individuals is usually due to the amount of water that you have. And so it's mostly controlled by the kidneys by retaining or releasing water. Okay. Obviously, though, blood volume could change very dramatically if, say, you had a very bad cut and you were bleeding out a lot. Your blood volume would go down. So then what would happen to blood pressure? It would go down. You could go into a thing called shock, where your blood pressure gets too low and you have difficulty maintaining body systems. All right. You could be very dehydrated and sweating too much, and you're losing a lot of water, and therefore you're losing a lot of blood volume because that water is being replaced by the plasma of your blood. Now, there are other factors, and you can just think of these that might affect blood pressure: how old you are, your weight, your emotional state, the body position, whether you're standing, sitting, lying down. Even the time of day will affect blood pressure. Drugs, obviously some drugs are given to change blood pressure, either up or down. And then, of course, exercise. And we like exercise because it's a controlled way to increase your blood pressure, but it's doing it by making your heart work more. And it's, in effect, making a healthy heart because it's giving exercise to your heart, making your heart work strenuously, but in a controlled way. So we like exercise, increasing blood pressure short term, and that often helps your blood pressure be lower when you're not exercising. Now, this last picture here, before we go into the selected diseases, is on page 384. And this is very complex, and you do not need to memorize it. But what it's doing is it's showing a lot of the things that we just talked about and where they impact and how they end up getting increased blood pressure. So what I usually write here, so you don't worry about this for a test, is I say don't memorize, just understand the basics of how we might raise or lower blood pressure using some of these terms, some of these things that we just talked about up here. Okay? But that's a nice visual so you can see how they all work together. All right. Our last two things we're going to talk about are the two different disorders that I picked. And the first one is hypertension. And I picked hypertension because it's so common. So many people have hypertension. As I said, it's elevated blood pressure, usually values about 140/90. Now, I wrote that a couple years ago. The more current guidelines are even saying that you're slightly hypertensive around 135/85. So, but it does vary. Some people are just born with slightly higher blood pressure. Some people have very, very low blood pressure. And so if they were 110/70, high blood pressure to them could be 125/80. So we sometimes have acute hypertension, meaning temporary hypertension, in response to illnesses, exercise, like I was just talking about, or emotional upset. That's normal. All those things are normal. Chronic hypertension can be very dangerous if uncontrolled. What are the signs and symptoms? Well, often there aren't any. It's sometimes called the silent killer because we don't know that we have high blood pressure. But sometimes people have such high blood pressure they can have headaches, dizziness, nosebleeds, etc. Now, there are two types of blood pressure. There's hypertension that's primary and hypertension that's secondary. And primary hypertension, there's no identifiable cause. Probably a number of factors cause this hypertension, but no one thing causes it. And this is most cases, about 85 to 90%. However, there is secondary hypertension, and this is due to other conditions like kidney disease, hardening of the arteries, tumors, medications, illegal drugs, all sorts of things. So what are the treatments? Well, the treatments can be medications. We can give things like beta blockers or ACE inhibitors that will slow the heart, and so the heart won't pump as hard, and therefore blood pressure will go down. You give diuretics to get blood volume down, get more blood out, more water out of the body. But better ones, if we could, would be lifestyle changes. Exercise more, eat better, lose weight, quit smoking. Those things can go a long way to getting your blood pressure back to a normal place. All right, now we have our second one, which is another big one, which is coronary artery disease. And in coronary artery disease, the definition of it is that the coronary arteries that supply the heart with oxygen and nutrients, there should be a closed parenthesis there, are damaged or blocked. Okay. This picture, which is on page 3, well, it's changed in the book now. It's on page 386, and the picture looks a little different. I actually kind of like this one better. 386 shows a coronary artery that should be this open. That's what it should normally be. All of this right here is plaque buildup. Look how narrow the coronary artery is. maybe, I don't know how big it is, but maybe if this was a red blood cell, look at how few red blood cells could fit going through there at any given moment. Maybe only 4 or 5 at any moment, as opposed to maybe 10 or 15 if it was all the way open. So what are the signs and symptoms? Well, again, sometimes at first nothing, but in the late stages we have chest pain, shortness of breath, and then we'll often have a heart attack because we're not getting enough oxygen. The cause is usually from a plaque buildup, and this plaque buildup is a combination of a bunch of things, but often is a fat cholesterol buildup, and that results in narrowing or blocking of the arteries. This damages that inner layer, that intima layer of the coronary arteries. It's called endothelium. So what are some treatments? Well, again, lifestyle changes, if we can do them, are great, like exercise, nutrition, lose weight, quit smoking. Same things as the ones that we just talked about above. Same kinds of medications can make the heart work less hard and can make maybe the chance of a heart attack lower. Aspirin thins the blood and makes the blood volume less, and that also might help the blood move through these narrowed areas. But in late stage of the disease, there are surgical procedures such as angioplasty and stent placement, which widens. It's a little balloon that gets put in here that widens and holds the artery open with the stent. And then in severe cases, we can do coronary artery bypass surgery. And what we do there is we basically just stop using this vessel. We take a vessel out of the leg or another part of the body. And then what we do is so you have a damaged vessel here, we route a new vessel around it and kind of attach it at either ends. And so if you have a big plaque buildup here, we'll put a new vessel around it, and that's why it's called a bypass surgery. We're bypassing the damaged area with an artery that we get from another part of the body. Now, you might have heard of like double, triple, quadruple bypass surgeries. That refers to the number of arteries that have to be bypassed. So a quadruple bypass surgery, there are 4 main coronary arteries inside the heart. All 4 of them are so damaged that we have to attach new arteries to them and route the blood around them. That's very severe, where a single one or 2 or 3 are a little less. Okay, so there's our cardiovascular system. A nice overview, not super detailed, but enough so you can understand what's happening. So I'm going to stop there. If you have any questions, make sure you email or get in touch with us. And thanks.